Hello, and welcome to Beyond the Surface. The Healthcare Surfaces Institute was founded 9 years ago to examine a frequently overlooked foundational factor in the spread of HAIs. Over these years, we've gained valuable insight and effectively highlighted how surfaces and products can support and harbor microbes, along with the challenges healthcare professionals have encountered when attempting to clean and disinfect them. I'm Linda Liebert, the Executive Director of Healthcare Surfaces Institute. On our podcasts, we will interview healthcare experts, patients, thought leaders, researchers, and many others about the challenges we face in our ongoing battle to mitigate the spread of microbes that cause HAIs and solutions that are being introduced. I am really excited about this podcast today. I've got a very interesting guest. We often forget that a patient is the most critical person in this whole discussion about HAIs, healthcare-acquired infections, etc. And we also often forget the profound life-altering facts that take place when someone acquires an infection when they're being treated for something completely unrelated. 1 in 17 people that go into a healthcare facility will acquire an infection which is totally unrelated to the care that they had sought treatment for. I am thrilled to introduce you to Jeanine Thomas. She is the founder of the MRSA or MRSA Survivors Network. Jeanine Thomas founded MRSA Survivors Network in 2003. And it was the first patient advocacy for HAI organizations in the US. She also founded the World MRSA Day, World MRSA Awareness Month, and the International MRSA Testing Week. Jeanine is a survivor of MRSA, sepsis, and C. difficile. Each of those came in at different times, and we'll talk to her about that. After contracting MRSA during surgery to repair a broken ankle, she was critically ill and had to have 7 more surgeries to save her leg. She was ill for several years and left with a compromised immune system. Jeanine worked on legislation in Illinois, first in the nation, by the way, to mandate that MRSA be a publicly reported disease, and initiated legislation in 2006 to require Illinois hospitals to screen high-risk patients for MRSA upon admission. Again, first in the US, and it passed unanimously. Jeanine is a designated patient safety champion with the World Health Organization for the Alliance for Patient Safety, FDA-appointed consultant, and patient representative on the FDA Antimicrobial Resistant Drug Development Advisory Committee, and has served on numerous boards and councils for many years. Jeanine has also received several awards. So Medically Induced Trauma Support Services, MITSS Annual, which is the Hope Award for the Greater Boston Medical Community, the Patient Safety Foundation's Patient Safety Award, and the NBC5 Chicago's Making a Difference Award. It is my pleasure to welcome Jeanine Thomas. Hello, Jeanine.
Hi, Linda. Thank you so much.
Yes, so
Good to be here.
We're so happy to have you. So, let's start out by talking a little bit about being a patient going into the hospital for, in your case, surgery, and tell us a little bit about what happened and what happened to your life as a result of it.
My life was really changed dramatically in 2000, in end of 2000. I slipped on black ice and broke my ankle, and I had to have surgery. And during surgery, I was infected with MRSA, and was in the hospital for a while and came back home. And then, it became a big fever, very sick, and went back in. And when they took it off, it was horrific to see my ankle swollen and just the decayed tissue, everything. And it was on a Friday night, so that's the worst time to go into a hospital. And so I had eaten something that day, so I could not have surgery. And so it took a while. Back then, they did not have rapid testing. So I became sicker and sicker. I was not on the right antibiotic, and then it was fighting for my life. And so I don't remember the first, 4 or 5 days that I was there.
I want to back up a little bit because you actually talked about a couple of really important things. Number one, there was no screening. So when you
No.
went into the hospital, they didn't actually know what you had, correct?
There wasn't rapid screening because they could have gotten that back in a couple hours. So it took 2, 3 days, it took till Monday because over the weekend. And so that's what, and it came back. And then still, my surgeon didn't put me on the right antibiotic. I didn't go on vancomycin. So I was deteriorating. And I had a surgery, which I don't remember, the first one. And I was going downhill until I, had a coating in the middle of the night. I had 105 temperature,
Wow.
and then I knew I was passing away. It
Yeah.
was, I was flatlining. I was gone, but they were able to bring me back and put me on the right antibiotic. But then it was still, very hard struggle. And then they realized I had sepsis.
Wow. And so the right antibiotic is key. We had Dr. Rodney Rohde talk to us a little bit about microbes and the fact that while there's MRSA, there are many different strains of that. And not all of them are responsive
Yes.
to medication the same way. And so this is your story because the first thing they put you on
Mhm.
didn't work.
Well, it was a broad spectrum, and there was only one antibiotic back then, vancomycin, which had been around for a long time. So I wasn't on that. So it was not helping me with my infection. And so that was a problem, as a slipping through the cracks there, not calling an infectious disease specialist in. So the weekend playing where a lot of people were, not around, that type of thing. So it was a complete, an array of a disaster to happen.
Yeah, sounds like it. And so they finally were able to diagnose you, but at this point in time, you also had sepsis, which
Yes,
creates a
yes,
whole different issue. So
yes.
tell us a little bit about sepsis and what happened.
Sepsis, and I also had osteomyelitis, which is a bone marrow infection. So that happened too. So that was also a really big part in trying to treat and to save my leg. And I came very close to having it amputated from the ankle up. So I had several more surgeries, so they were trying to save my leg. And sepsis is, you don't really know what's going on when you're very, very sick. You just
Right.
know you have a high fever. It's just awful. I mean, you just feel everything shutting down. It was a time where I didn't really know what was really happening to me. Nobody was
Right.
telling me.
Yeah.
So
So it sounds like, one illness. So you go in for a surgery for a broken ankle. You acquired MRSA. Nobody
yes,
recognized it. So then you got the second one, the myelitis,
osteomyelitis. Yes.
osteomyelitis, as a result of that first infection, which also then progressed to sepsis. So it was just sort of a gradual progression.
Well, what happened, osteomyelitis, and my ID doctors told me this, that there was contaminated surgical instruments because they went right in when they're putting the plates and the screws in, it went into the bone marrow. So because those were contaminated, that's the only way that that could have happened. Because I didn't have broken skin from my ankle, breaking my ankle, there was no broken skin. So the only way that it could have come in is during surgery.
So
Oh,
surgical equipment, which are
right,
services, which are issues that we've talked about many times. Um,
right.
and so eventually you started to get better, which altered your life. Can you talk a little bit about from the time that you started to realize where you were and what had happened? Tell us a little bit about that progression.
Well, after I got out of the hospital, after a month, I got out of the hospital, and then I was sick a couple of weeks later with C. difficile. I came back in the hospital, and so it was a concoction of antibiotics, and they didn't have all of the ones that they have now. So it was very hard on your system, very hard, is to now deal with another pathogen. And so, it prolonged, my recovery.
Yeah.
but they were able to save my leg. But I needed a bone graft and a muscle graft, and because of the infection, I could not have that. So I have a weaker ankle now because of that. So
Wow.
it was life changing. You learned. I was an athlete, A-level tennis player, and could never play tennis again because I couldn't stand that movement on my ankle,
Right.
even with a brace on it. It just so your life changes, but I was a very positive person and very working really hard. To as an I was one of my majors was athletics, so I was working really hard to keep my legs strong and to keep myself strong. But you are really depleted your immune system, your flora from all, and you have to stay on antibiotics for a long time.
Yeah. And because you are a very positive and strong person, I've gotten to know you a little bit over the last couple of weeks. You became an advocate. You said,
You
enough,
did.
I need to do something about this. So tell me a little bit about where that.
Well, okay. What happened that is, living in the Chicago area, I knew in Illinois, I knew 7 other people who had, once I found out I had MRSA, first they told me it was just an infection. Then I said, what kind of infection? And they said staph, and I said, okay. And then finally, my ID doctor told me what I had, and I said, okay. And there was nothing on the internet back then, so I really couldn't find much information. But I had a girlfriend whose mother died of it, and she was a school teacher, so she told me a lot about it. And so I knew 7 people. I go, wow, something's going on here in Chicago, in this area where nobody's talking about these infections. And they come find out years later that Baltimore and Chicago were ground zero for MRSA. So from all the antibiotics into the hospitals. So that's why there were a lot of infections. But I said, okay, how can I almost die from an infection? I was very healthy, extremely healthy. So I decided to look around and to see what I could do. And Chicago Tribune had done a expose, 3-part series, investigative series on HAIs, the first one in the country. And I called Mike Behrens, who was the investigative reporter, and I said, look, I'm a survivor of this. Is anybody else working on it? Because I want to raise awareness. And he goes, no, Jeanine, there isn't. He says, I don't know anybody, but it starts with you. And that started to be the catalyst. Okay, what can I do? And I called my state representative and my state senator, went in and saw them, told my story, and showed them my ankle. And they're like, wow, let's call the public health department. And that started everything really going.
Uh-huh.
And then State Senator Barack Obama introduced a bill for public reporting because it was not a public reported disease. It didn't even have an back there, ICD-9 code. So there was not reporting of it. And so that got the ball rolling on everything.
And that's fabulous. And from there, you formed the MRSA Survivors Network.
Yes,
So
yes.
tell us about that organization, who's included in it. Tell us a little bit about that.
Okay, I was placed on the state board for HAIs prevention, and so I met a lot of key players, and I said, okay, well, there are so many people I know. I felt I was in complete isolation about my disease. It was the pioneer era. Yeah, I had no one really to talk to about it that had survived, and so that I knew. So it was isolating, not being able to talk about a disease that you had, and you know that it is treatable, but most of the times, it's in your system and it can come back. In my case, it did. So I said I need to start an organization. And that's when I decided to help families and survivors and give information and talk about what is happening with this disease and
And now
HIs.
you are an advocate. So people that are going through this can call you and you will support
Yes.
in your organization.
Well, we have the only crisis hotline because
Yeah.
you would not get information that you really need from the CDC. They did not have a hotline. There was nobody. So I've spoken to thousands of people from all over the world and get emails constantly about, but now it's so much better because now people are aware. But it was very difficult because my state legislators had never heard of this. And they said, we would do something sooner if we would have known about this, but it was a secret and silent killer. And in so many ways, it still is. It's an ongoing epidemic.
That is typically not discussed either, which
Right.
is one of the reasons why our goal is to bring survivors like yourself onto the podcast to be able to tell their story, because it's interesting. I've done several conferences where my first question to the audience is, how many of you have either been affected by a hospital-acquired infection or HAI, or have had known someone or
Right.
lost someone? And it's amazing to see the amount of hands that go up, but yet
Yes.
still that silent, hidden epidemic that we really don't talk about.
Right. It's just sort of, I mean, really, it's a medical error. It's a never event. It should never happen because it's by contact, especially with MRSA and staph. So there just still is that stigma, which I'm trying to work at, to let's have it transparency. Let's have it out there. I mean, our cats and dogs can get MRSA too, and our cattle and farm animals. So it is spread out into the community. I mean, 85% are hospital acquired, but there is still that in the environment because of using antibiotics and all of that. It's still out there, and it's spreading in schools and facilities. So it is something that it is still a public health crisis.
Definitely. Definitely. So there's a lot more than just MRSA for healthcare acquired
Yes.
infection. I mean, you talked a little bit about also acquiring C. difficile, which is also typically it started as a healthcare acquired infection, but that too has moved out into
Yes.
the community as well. So protecting those vulnerable patients who have immune compromised systems within the hospital are really critical. But at the same time, how did you begin to address them? And you talked about one of the ways that you acquired your infection was through contaminated instruments. And so there needs to be an awareness about surfaces, which is one of the reasons why the Institute was founded. We are really excited about having you be our keynote speaker at the HSI Summit, which is in
Well, thank
April.
you.
To be able to hear more of your story and be able to talk a little bit more in detail about the things you were able to achieve. So you actually facilitated, or through then Senator Obama, you were able to create legislation that required early detection. Tell us a little bit about that, or testing.
Okay. The thing is, I never thought I was going to do legislation because I just wanted to raise awareness on the state board, and I saw that they really didn't want to do anything. And it was all the stakeholders, government people and ID doctors, the state health department, everybody was there. And I was the lone, of course, patient advocate, which was really rare for back then even. And so I saw that they really didn't want MRSA to be a reportable disease. And I thought, okay, then you're not going to do anything about this. Well, then I have to do something about it. So and I had a great physician advisory board, the best in, world-renowned doctors with me. So they really educated me fast on everything, the history from 20 years ago of MRSA. So I went to my state senator, and who was the minority leader in the Congress. So we decided to put in legislation to mandate all at-risk patients to be screened upon admission. Weren't going to do universal because we knew that wasn't going to pass. Went nowhere for the first year. We had a lot of fights. We have AMA, AHA, everyone here, in Illinois. Nobody wanted transparency. And it wasn't about telling them what to do. It was, let's save lives. We're at this point. And needless pain and suffering. It's egregious because I know how much pain and suffering I went through. It was horrible pain, bone pain, infections, I think are the worst. And it went nowhere the first year. The second year, I was able to get the Illinois Hospital Association to support it. And they were the first in the country. And they ran the numbers, and they said, in Illinois, I can't remember how many thousands had MRSA. And the deaths were just astronomical. They said we can't unknow the known now.
Yeah.
So they took a lot of heat. They were able to say, look, we have to support this because, this is ethics. Ethically, we cannot allow people to be, um, to do nothing about this. So that's what was key, was the support. And it passed unanimously the second year. All at-risk patients, which is about 85% of patients, should be screened upon admission. So we were the first in the country. Then it was Pennsylvania, New Jersey. We worked with other states together, but it was really coming out of everything came out of Illinois. And with then Senator Barack Obama's first bill. I worked with Senator Durbin for a federal bill, but then they said it was going to be state by state. So anyway, and then in 2011, helped initiate and pass legislation that mandated if MRSA was a contributing factor or cause of death, it had to be put on the death certificate. So we know how many people are dying from this, and also to get more research funds. And I was the second in the country. Washington State was the first, and I was the second. And so, this was pivotal that we had to do this legislation for this. And I never thought I was going to do, but thank goodness I also was a history major, so I knew something about civics. That kind of helped me. But I had great support from the legislators. They were on board because they all had all of a sudden they realized they had family members, and everybody is at risk. Every single person, and our pets. I mean, so it's, this is a ongoing epidemic that has just never really been addressed.
And we are so grateful that you are at the helm doing this, even though it's amazing what one person can do. And that's build the network that you need, get the support that you need, and actually be able to implement legislation. And I personally am so grateful that you went ahead and did that, because I know this has really changed your life. But
yes,
you're
it did.
Making a difference for the future, for others that may end up having to deal with MRSA as well. So Jeanine, I have a really important question for our listeners here. What can they do to be empowered to protect themselves when they have to go into the hospital? And granted, we have emergency situations, but there's still things the family can do. What would your recommendations be?
Okay, if you know you're going into the hospital, first you should get screened for MRSA, and get screened at least a week before, maybe 10 days, because sometimes it takes, depends if it's rapid testing coming back. And decolonize so that it's a nasal swab, just like with COVID. And you can see if you're colonized. If you're colonized with MRSA, you have 10 to 12-fold greater chance of getting an infection. And it takes, 4 or 5 days also to decolonize with a antibiotic. And then you also, a couple of days before 3 days, I say 3 days before you go in for your surgery or procedure, wash your skin with a Clostridium, and that night before, wash again. And this decontaminates your skin. So these are the things that you can do to prevention. And if you're in a hospital or a healthcare facility, you ask your family members to come in with antiseptic wipes. Wipe all frequently touched items, even the faucet in the bathroom, the TV remote, the phone, the trays, the railings, everything, because it might have gotten missed in the cleaning. So these are another way, frequently touched items. And then also ask, and if you must, and it's hard to do, is to ask your healthcare worker to wash their hands before they put the gloves on, because sometimes they'll pull them out of their smock. Well, those are already contaminated. So wash their hands, don the gloves, and after they're administrating to you, they take them off, and they should wash their hands again. So therefore, you're stopping the transmission going on to another patient and to another room. These are contact precautions that should be doing, definitely.
Yeah. And you mentioned that sometimes it's difficult. I've heard that from other survivors, to ask the healthcare provider to please wash their hands.
Right.
Is there a way that you would recommend that happen? I mean, give us some sort of a soft way to ask?
Well, I think they're in a hurry, and it's always like sometime, and I've had even doctors just don't do it, and they certainly know better, and then other workers, but just say, look, I need you to wash your hands before you get those. I'm afraid of getting infected, or and I've just had surgery, and just that's the way that you should do it, a soft way. And they always do it. They don't say, well, I'm not going to do it. It's just they're always in a hurry, so they just pull them out of, and they contaminate the box if they don't wash their hands first. But there is no excuse for that, really, when you think about what can happen to somebody if you don't do that. So there needs to be more, certainly, hand hygiene monitoring, definitely, because we can get that rate up, definitely.
Yep. And isn't it interesting that 20 seconds of washing your hands can make a difference between someone acquiring an infection and having their life altered?
Right.
Or, it's a simple thing and so critical.
Yeah, it's life altering, definitely. It just you're never the same. Your immune system is affected. So and so therefore your microbiome. So it just takes a second of them to think, because a lot of them, I know they're working really hard and they're not really thinking about it sometimes. So, don't be afraid. A patient should not be afraid, or a family member to speak out. Yes. For sure.
Definitely. So I would like to thank you so much for spending this time with us. I am really, again, excited to have you as our keynote speaker for the Healthcare Surfaces Institute Summit, which is the first part of April. And we will put in information on this video for them to be able to reach out to you if people are interested in joining your organization or would like to talk further with you. And I would like to thank you so much for spending the time with us today.
Well, thank you for having me, Linda. You're doing great work also, because decontamination of surfaces is very, very important. It's many, many approaches that we need to do everything that we can to stop these infections.
Yes, definitely.
Prevent them. Prevention saves lives.
It does. I agree. Well, thanks again, Jeanine, and
thank you.
Talking with you soon.
All right, thank you.
Thank you for listening to Beyond the Surface. This podcast is brought to you by ISSA, the Worldwide Cleaning and Facility Solutions Association. Please subscribe and write a review for us on whatever platform you enjoyed this podcast on. For more information, go to healthcaresurfacesinstitute.org.